Hi, I'm Jessica Bolton from Daily Mirror, and I'm joined by our head of politics, Jason Beattie, here. And we're joined today by Dr. Rosena Allin-Khan, who's Shadow Cabinet Minister for Mental Health and also a frontline doctor who's been working throughout the pandemic. We're joined today because we're running the 7-day series looking into the effects of the pandemic on mental health over the last 20 months or so, across all sectors of society. It's part of our Headstrong campaign, Better Mental Health for All. So from kids to elderly, key workers, all sorts of different areas of community. There's some very important issues we've been wanting to raise and things that we want to get changed to help everybody out there. So thank you so much, Dr. Rosena, for joining us today.
It's a pleasure. I'm so excited to be here, and I'm super proud of the work that you're doing to put mental health on the public agenda.
Thank you so much. I mean, that's fantastic. We started this week with the campaign with a poll of people of all ages, and one of the startling results was that a quarter of people, 26%, said that their mental health had deteriorated during the pandemic. Obviously not all linked just because of the pandemic, maybe triggered or made worse, but it's a shocking figure, isn't it?
It really is, and it's absolutely heartbreaking. And to be honest, it's reflecting what I'm seeing in my MP inboxes with people crying out for help. It's reflecting what I'm seeing on the front line when I do my A&E shifts and people are coming in so desperate for help. And I think it's due to a number of reasons, but also I know that your brilliant poll that you did also showed the real need that there is amongst children, and that is something that I've really been experiencing in my professional capacity as well.
Can we talk a little bit about being on the front line? How you managed to do both of these things is amazing, honestly, because you took up the position of Shadow for Mental Health in 2020 as well, and you've been working like 12-hour shifts, haven't you, on the front line during this time as well? There you are there. Can you tell us a little bit about what it's been like during those shifts? I mean, you must have seen some awful things.
Yeah, my goodness, Jessica, it's been a real whirlwind. You know, sometimes when I think about reflecting on it, there are a few things that never really leave me. Firstly, it was just the unexpected nature of going back and doing that many shifts a week. Obviously, I've never ever stopped being a doctor. You've covered me doing that for the last 5 years I've been an MP. But there was that real sense of urgency to get back to the front line with my colleagues. And I was doing sometimes 3 or 4 shifts a week, and I was working in the A&E, but also working in the intensive care as well in East London. And the thing for me that really hit home, that was so startling right at the outset, was that COVID had laid bare the inequalities that we knew existed in our society, but they were laid out there in technicolor. Rows and rows of beds in the intensive care unit, filled with people from our Black and minority ethnic communities, from those from poor socioeconomic groups, people who've been driving our buses, people who've been serving at our supermarket checkouts. But the real startling thing, and the thing that used to make me tearful on the way home, and I thought I'd seen it all. I've been working in the field of humanitarian medicine and A&E for 15 years. I thought I'd seen it all, but the thing that struck me the most and had me crying on the way home after every shift was that feeling that so much of this could have been avoided. People not going to work with PPE, like lambs to the slaughter, in people's own words. And that sense that, this government didn't have a handle on things soon enough. We didn't go into lockdown soon enough. We didn't have mass testing and tracing, PPE contracts given to mates and lack of PPE on the front line. It was just it was just heartbreaking, and just tearing families' lives apart. On the phone, telling them that the person they loved the most had died in the whole, the person they loved the most in the whole wide world had died or was dying, and they couldn't come and see them because of this horrible virus called COVID, was just like nothing I'd ever done before. Or on the rare occasion that you could take someone in to say goodbye, you had a family of 5 showing up, and you had to pick one, and you couldn't even hug them like you normally would. It was brutal. It was brutal, to be honest. And then, of course, the fear of bringing COVID home to your own family, all of that was horrible.
It is one of the areas that we're looking at later in the week on the series, as you all know, is sort of the mental effect on NHS staff, from, you know, for the doctors and the nurses and the janitors and across the side, because for us on the outside, I mean, it's hard enough anyway dealing with the pandemic, but for obviously you on the front line seeing it there, I mean, it's unimaginable for most of us to understand how that could be. And like you were saying, picking somebody who gets to go and see their relative, what have you seen in terms of the sort of mental health of sort of NHS workers and people trying to cope with this?
I've had friends and colleagues all around the country sending me messages in the middle of the night saying they're scared to go to work, saying they can't cope anymore with their feelings. We know that suicide rates and suicidal ideation in, you know, frontline workers has gone up, but I think it's so important, you know, and you've touched on that, it's everyone across the NHS, isn't it, in our care workforce, because the porters who've been carrying dead body after dead body from the intensive care to the morgue, it's the receptionists seeing those desperate family members and them not being able to get in to see their family. But the one thing that really hits home to me when I think about the mental health of frontline sort of care and you know, hospital staff is normally, like, the coffee room is full of chatter, and, you know, everyone, you know, pinging their food in the microwave, having a good old chat. But I just remember people looking out the windows, just exhausted, no one talking, just silent rooms, people just in their own emotions, exhausted, people's faces marked by the PPE when it finally arrived. And just that sense of emotional exhaustion, but also the feeling that people were not trained for this. You know, our NHS and care staff are not trained for sort of mass death of this nature. But I think that the hardest part. Oh, sorry, you're going to say something there.
I don't know. I was just going to pick up on that point. Sorry to interrupt. Is you know,
no, right.
NHS workers under a lot of pressure at the best of times. This was an extraordinary kind of event, and I'm just wondering, you know, is there more support we can give them? Is it adequate? How else could we help them?
Well, I actually launched on behalf of the Labour Party the Care for Carers package last year as a policy proposal. It was for frontline health and care workers and everyone across our NHS, you know, porters, cleaners, everybody, to be able to access quick and timely post-traumatic stress disorder support. And unfortunately, the government refused to meet with me to discuss it. But we do have new ministers in post, and I will be asking them to meet with me to discuss it, because the key thing is that PTSD, the sort of trauma that people get from this nature of work, needs to be treated very quickly. And also it needs to be a 24-hour service so that somebody can call and ask for the help that they need at 2 or 3 in the morning. Because when you work shifts, you can't fit a 9-to-5 pattern. It also needs to be something that is in a place and done in a way of safety. So you don't have to go directly to your line manager, who might be the person asking you to do the extra shifts that you can't cope with. So there is more that needs to be done. And the Care for Carers package, a lot of work was done on that, and the unions are very much behind it, including the Royal College of Nurses. But obviously the government are yet to engage on it, but I'm continually pushing them on it.
Because that was one of the issues we're thinking of, is that if you and we're sort of exploring, we've got some people who are talking to us in the paper, some heartbreaking stories coming up, where people don't want to tell their line manager because, one, they're worried about their job, in a sense of, you know, they don't want to have to sort of sign themselves off if they don't need to, and also worried about sort of not wanting to be seen to be moaning about their mental health when they're dealing with a situation such as this, which is so unprecedented. But it feels like a lot of people, and we're hearing from a lot of people, that they had nowhere really to turn to. I know the Samaritans have done a great line of a sort of listening line, so people can ring up and get support in the meantime. But in terms of actually getting the actual support to get actual help, and to get in that process, at the moment, people are still having to go through their line manager. Then if you're on an NHS waiting list, of course, to get help for a therapeutic appointment, that's a whole other issue that we've discussed about. The times that it's going to take on the waiting list is still very, very high. And and even with the pledge that it's going to be reduced to 4 weeks by 23, 24, which is part of the government sort of new package they announced back in July, that is often calculated by the time of your first initial phone assessment, isn't it? Rather than starting actual talking therapy or starting an actual treatment. So it can be a lot longer. What can be done in that system to help? You've got people too scared to ask for help because they know that they're going to have this ahead of them.
Yeah, so I think a key point as well, just to add to everything that you've said, which is absolutely spot on, is stigma. Going to your line manager and saying, I don't feel well, I'm struggling to get up in the mornings, I can't stop crying, or actually I think I'm drinking too much because of the stress. It's very difficult if you're worried that that's going to follow you around from department to department or hospital to hospital, or even within your own department. And I think the key thing absolutely has to be a safe space to talk about your mental health and how you're feeling. And I think as well that the really important thing, and that is why I'm so excited that like the Labour Party have actually announced this. We have announced that we would guarantee mental health treatment within a month for all who need it. And that is not a referral and then an initial phone call to then go on a waiting list for a year and a half. It is to say that you will have your treatment started, whether that is the talking therapy that you need, whether that be the antidepressants that you need started, you will have that within a month of referral. And I think that's really, really important, because we know that the more time lapses between needing help and getting help, the more help you need in the end, the longer the treatment takes, and the worse off you are. And the thing about mental health is it's not about shiny bits of equipment, it's about people.
That's a very good point, actually. It's about having the right professionals in place, because the talking therapy in terms of equipment costs nothing. You don't need these great big machines. You're right. It's about having enough staff, which compared to the price of an MRI machine is minimal. So I know one of the other big drives is to get more mental health staff across the board, and that's one of the ones that we're echoing in our demands as well as the 4-week waiting time to actually start treatment.
And that's one of the Labour pledges as well, to recruit another 8,500 mental health workers. That absolutely has to go hand in hand, because right now, the way the Tories have underfunded and under-resourced mental health over the last decade, along with all of the other stresses that people have in their life that so significantly contribute to poor mental health, we really need some proper investment in mental health that will grow the workforce and allow people to get the quick and timely help that they need, because ultimately that is what is required.
We've got a comment here, Charlene Bianco, saying therapy is a long waiting list. As we just said, it is difficult to find staff. I don't know if they're saying it's difficult to find staff to fill those positions. If that might be an area, is that a case? Or
sorry, so I lost you there for a minute. I think you're asking me about the difficulty in having staff to fill the positions and the vacancies, and that is part of the problem. Is because staff are so overstretched and undervalued, so many people are leaving the workforce due to stress. The number of sick days that have been taken due to mental ill health in some months last year exceeded those sick days taken by COVID within the NHS workforce. So absolutely, it has to be about supporting the workforce that we already have, as well as supporting them with their mental health, growing the workforce as well to deliver the care that people need. Because absolutely spot on, waiting lists are phenomenally through the roof. And we know that because people can't access the help that they need, for example, there was a 147% increase in ambulances bringing people to A&E due to mental health issue from 2010 to 2020. That is phenomenal. That's because people can't get the help and support that they need. And in 2010, there was an average of 795 people attending A&E due to mental ill health. And in 2020, it averaged 1,967.
Yeah.
That is a huge number.
It is a huge...
Really interesting point by Charlene here in a follow-up comment. She points out two things: that lots of people lost the kind of access to services which are good for people's mental health, like, social groups, going to kind of a drama club or a gym or doing sport. And then she says, quite interesting your views on that, Rosena, but also she points out some people still hesitant to see their GP because they think that their mental health will get kind of ignored or dismissed. Is that true?
That's an incredibly important point, and my GP colleagues work incredibly hard and do a phenomenal job. But yes, it is true. A lot of people do feel as though they don't get the understanding and support that they need when they go and visit their GP. That in part comes down to training. I think there needs to be more robust training at every stage of medical education, right from like the outset at medical school all the way through people's professional career. But we also know that there are groups who unfortunately have a worse experience than others when visiting their GP. And we know, particularly if you are Black, if you are a young Black man, for example, you are 4 times more likely to be diagnosed with mental illness when you've already entered the judicial system because of the difficulties accessing services. And we know as well with other communities, having culturally appropriate services are really important. We also know that if you're part of the LGBTQ+ community, you can have a lot of difficulty accessing health services where you feel that somebody understands your needs. And we know that you're more likely to suffer with mental ill health if you're part of that community. So we absolutely have to get this right for people. And people really are afraid for a number of reasons to go and speak about it. And we have to challenge that culture. But just on the point as well of being able to access sport and clubs and youth centres, that is huge. I mean, literally just this weekend, I was at my local boxing club where they had a show. I train there and I'm also the club doctor. And just knowing how that place, Ballon Boxing Club, has transformed young people's lives. It's like a family. It's where they get to go to, because not everybody has teachers or family members that they can go to when they're struggling. And having somewhere like a boxing club or, having a football coach, just having someone that you can trust is so important. And we also know the value of exercise and socializing, for good mental health. So all of these things play a part. And I think what's really, really important is that we've pledged as the Labour Party that we would put an open access mental health hub for children and young people in every community. And there's a fantastic example of that just in my local community, the Wandsworth Community Empowerment Network, that does a lot of good stuff for young Black and Asian and minority groups in particular, but also those from poor socioeconomic backgrounds to come and have the support that they need. But we need that more. We need to be open about talking about mental health. But then when we're telling people it's okay to talk about your mental health, we need spaces for people to go where they can get the help and where they can talk about
it. And where they can get that help quickly and feel like they're being heard. I've had several sort of messages since we started doing this at the beginning of the week. And one of the key points is people don't feel like they can get the help quick enough. People paying to go private, which is a privilege that some people have, but it's very, very difficult if you're on that sort of road where you're talking thousands of pounds in order to get some help. And then obviously people on lower incomes who can't afford that are being sort of left behind on that case. So I mean, it should never really be a society where people have to rely on paying for the extra help in that sense. But how long do you think it's going to take to improve this situation in terms of waiting lists and in terms of the overall sort of enough staff to help? I mean, because we're in this sort of crisis now for all these reasons and the cuts that have come up to it now, are we talking years before we have a mental health service that we can sort of be proud of in this country?
Gosh, that's the $1 million question, is it? Isn't it? But just going back on your first point, it literally breaks my heart when I'm doing a shift in paediatric A&E, and I've got parents coming in with their children, and their children have tried to take their own lives, or have eating disorders, or are self-harming, and they're saying, Doc, I just wish I had the money to pay privately. My heart cracks inside, because I think to myself, you shouldn't have to do that. We shouldn't be living in a country where you should have to do that. You should be able to get the help that you need, and it affects the entire family's mental health, and parents feeling that they're not good enough because they cannot earn enough money to pay for their child's private mental health support when they shouldn't have to in the first place. But it's going to take time to recruit staff. It really is. It is going to take time to grow the workforce to the point that we really turn back the clock on all of the under-resourcing and not having parity of esteem that we've had under 11 years of a Conservative government, quite frankly, who are absolutely out of touch. And little bits of announcements that are like little sticking plasters over a gaping wound. I mean, we absolutely have to address the gaping wound, and it isn't going to be a quick fix. It really isn't. But there has to be a political will to do so. And that, I think, is what is lacking. And I'm really hoping that the new Minister for Mental Health is going to push the government more. I mean, I'm certainly going to be coming at her in the way that I always do. But the last one just literally didn't have a clue. And it made it harder for there to be a sea change. And look, I was no huge fan of Theresa May, but because she'd had some personal life experience with someone that she cared about having mental ill health, she was a much more vocal advocate of it. She talked about parity of esteem, even though they didn't really deliver on it. She talked about it. And what I've noticed is, unfortunately, the political will is only there insofar as somebody has direct experience.
Yeah.
So I think that we absolutely have to bring, patients and their families and lived experiences to the heart of policy making and change. And I think it's our job in opposition to keep banging the drum and to have the cross-party conversations. I would love for mental health not to be a political football. I would love to sit down with the government and say, look, we all can see there's a problem. The Mirror have done their poll. Other polls are out there. We can all see there's a problem. What can we do? Let's work together. And that's what needs to happen for there to be a change. But we also have to stay positive. Labour have had some phenomenal announcements. We really worked hard on this. Under a Labour government, there will be an improvement. But obviously, until we're in government, we have to make the case non-stop to this government for there to be the improvement that's needed.
There to be improvement.
We just about the comment here, because it's quite an interesting point that they're saying that in their local waiting list for more than 2,000 children, they're waiting up to 9 months. One of the things we've noticed is there is this kind of very kind of postcode lottery when it comes to kind of mental health support, particularly for CAMs. Why is that? Why are you live in a rich part of London, you can kind of your child can get seen relatively quickly, but if you live in a poor part, you can't?
That's really interesting, and that's not just seen in London, it's seen across the country, and it actually isn't always related to how much wealth there is in the borough, interestingly enough. But the postcode lottery is, quite frankly, outrageous, and people wholeheartedly deserve better. There are some parts of the country, and even within cities, where if you live in a certain part, a child is up to 50% more likely to have their case closed so without even being seen. So a referral is made, and only about 50% of cases will actually be seen. On another side of the street in the same city or another part of the country, 98% of those referrals will be seen. The postcode lottery is scandalous. And there absolutely has to be a uniform approach. But fundamentally, if we are not giving our children and young people the mental health support that they need, we are letting down an entire generation of young people. And I see it play out in Technicolor when I'm doing shifts. I see it when I see young people coming in and their families coming in, and they're at the end of their tether. And I did some FOIs in my office. And worked out that some families are waiting, just for support with like autism or other issues that could be dealt with, and families, could have support 795 days.
Oh my gosh.
Sometimes anxiety, a case of anxiety in one can take up to 14.5 years to treat because of the length of waiting lists. Unbelievable.
And by the time it gets to that stage, as you said earlier, it's the issue is now so much bigger, and the mental health of those around them is then being affected as well. And it escalates into this. And I mean, you talked earlier about having to see people whose families of children who have been so desperate that they've tried to take their lives or they've tried to harm themselves. I can't imagine having to see that, but are we seeing that more and more now? And is that a danger for the young people because there's been so much about the stresses of the pandemic, not saying that any of that causes it, but triggers and makes things worse. Are you fearing that we're going to see more of that now with young people, especially with the sort of self-harming and more severe than that, possibly potentially more wanting to take their lives or harm themselves?
Well, we know, like, for example, just one example is eating disorders. We know that has gone up through the pandemic. But I think it's really important to note that there are two things at play here. Firstly, there is the actual issue of accessing the help and support. And that is just not as timely as it needs to be. But there are also all of the wider determinants of health and the inequalities that exist, and the fact that adverse childhood experiences are the single biggest driver of mental ill health for children and young people in later life. So poor quality housing, their parents not having jobs, needing to use food banks, all of these things that have increased over the last decade, now at such a breaking point. And we're seeing, obviously, like the cuts to universal credit again, all of these things leads to stresses that young people and children are just struggling to cope with. So you have all of that coupled with not being able to access the help and support that you need. It's a perfect storm to create the mental health crisis that we are currently in.
Yeah, and the universal credit, of course, tomorrow it's going to be the big cut there, £20 a week. It is going to make a huge effect on mental health of so many people, isn't it?
Absolutely. Absolutely phenomenal. And the number of people needing to use food banks, the shame that comes with that for some parents. I mean, obviously there must be no shame in needing to use a food bank, but they say my mental health, Rosena, it's terrible. I have to lie to my children and pretend that we've done an online shop and picked it up at the church. We cannot live in a country that's like this, and we have a government that are wholeheartedly out of touch.
Yeah, and obviously, I know we talked earlier about the impact of you were saying about the impact of grief on mental health during the pandemic, which so many people would have had to experience because of COVID and because of this time, and it's just been so incredibly difficult for people. Is there anything that you can say or words of advice for people on how to deal with that?
Yeah. What I would say very briefly on grief is that it's okay not to be okay. Help is out there. You can go to your GP, but there is no one size fits all model when it comes to grief. Everybody grieves in different ways, and each way is okay. For some people, it's needing to take the extra time off work. That's okay. For others, it's exercising a lot. For others, it's finding ways to make yourself feel happy in any way that you can. And there is no one size fits all. There are no rules, but give yourself the time that you need to grieve. And it's okay not to be okay. Help is out there and you're not alone.
Thank you so much for all of this. There's so many fascinating bits that we'd love to talk to you about, and I know that you've been very supportive of our Headstrong campaign.
Absolutely, I think it's brilliant.
And some of the key objectives that we're trying to push. So I know it's something that we really want to work on, because for our readers and for your supporters, it's one of the key issues, I think, that could really make a big difference to so many lives right now of just getting this done. So it's fantastic you've now got the new minister that you can deal with on that side, and as the other one, it was Nadine Dorries, who's now moved into a different position. So hopefully going forward, there's going to be more of a sort of a better dialogue, isn't there? You're hoping, just as the last question.
I'm hoping so. I'm absolutely hoping so. Look, I actually know Gillian Keegan because we play on the same parliamentary women's football team, and I've already had a discussion with her, and I just said, look, let's work together on this, and I'm hoping it'll be a much more collegiate relationship that will ultimately help all of our communities. It's in everybody's interests for mental health to be addressed properly, fairly, and for there to be true parity of esteem.
Fantastic. Thank you so much for your time today. We really appreciate it.
You. Thanks for having me.
Oh, it's been lovely to have you on. Thank you.
Rosanna.
Thank you.